Hi, this is a story of my wife's journey with her stage 3 breast cancer. In November 2020, she was told that her mammogram was all clear. In March 2021, she had a pain in her arm. And in April 2021, was diagnosed with stage 3 breast cancer. We questioned whether that cancer had been there since November 2020. And on reviewing the mammogram from the previous scan that she had to the current scan, there was a slight change. But the breast care team, radiographers, said that that change wasn't significant enough for us to be worried. I believe that we should have been told, and it should have been our choice then to decide what to do next. And I strongly believe that if we had been told in November 2020 that there was a change, we could have gone private and had a scan and had it tested to see if that was the onset of cancer. And if it was, we would have caught it early enough that it could have been treated and she may still be alive today. But we don't know that because it's in hindsight. Anyway, so we got referred to the oncology team after the breast cancer team said that once she'd had chemo, they would then do a lumpectomy to remove the remaining tissue, and then she'd go for radiotherapy. And that should be the end of it. And she'd be on hormone replacement therapy for the rest of her life. So we trusted what they said, and we went ahead and did that plan. She had 8 rounds of chemo, and towards the end of that first chemo run, they scanned her and found that the lump had gone. So we thought, great. They went in, did the lumpectomy to remove any residual tissue, and then they took a margin for testing. Unfortunately, that margin came back positive for cancer. In hindsight, it looks like the chemo had the reverse effect on her cancer. Instead of shrinking it, it made it explode and therefore spreading it further within her chest. They took another, she went in for a second operation and she had some more tissue removed. And they went and tested that. 3 weeks later, that came back as negative. There was no cancer to be found. After a blood clot issue that she had, she went and had radiotherapy. But after the radiotherapy, these lumps reappeared, which they did a biopsy on, and the cancer had come back. So she went in and had a third operation to remove the breast completely and lymphatic system as well, which they found cancer in. She was then referred back to the oncology team for another round of a different type of chemo, which she did 6 rounds of. But these lumps were progressively getting worse and spreading around her arm, or under her arm, sorry. When they scanned her again, they found that the cancer had spread and was getting bigger. It was not reacting to the chemo whatsoever. So they then took her off that chemo and put her on another type of chemo, which was tablet-based, to see if that would help slow it down. She did 6 cycles of that. On the 4th cycle, they scanned, but the mass was still growing. So they took her off that chemo and then put her onto a 4th type of chemo. During that 4th chemo, which was now we're into 18 months of various chemos, she developed a very harsh cough. that cough was so bad, it just made her ache and fatigued her so much. When we asked the oncology doctor to come and see her, he dismissed seeing her, saying, take a COVID test. She did a spit test that came back negative. 3 weeks later, when she came in for or 2 weeks later, when she came in for her next lot of chemo, we raised it again. So this was 6 weeks that she'd had this cough. They scanned her the following week, and it came back that the cancer had spread into her lungs quite severely. It had also spread into her liver. So we were not particularly happy that the doctor did not bother to come and see her, and she persevered. The Macmillan nurses were great. They said, try bronchial cough mixture, which sort of helped. She went on a course of antibiotics, which helped, because they thought she'd had a chest infection, when in fact the cancer had spread to her lungs. In January 2023, they told us that the cancer was spreading so quickly that there was nothing else they could do, no further treatments that they could give her. Her body was so tired and fatigued with the chemo that they were unable to offer anything else. So we went from a cancer that was treatable to a cancer that was so aggressive they didn't know what to do. In February 2023, my wife passed away. She lost her battle, and now I'm trying to fight to get change within the NHS oncology teams so they can be a little bit more agnostic about these patients. I strongly believe that if Jayne if they'd taken a step back, they would have found alternative treatments like immunotherapy or trials to help her cope with the disease. We also had end-of-life care, and the only thing they would give her was morphine. And I strongly believe that with the morphine that they were giving her, it was shortening her life. We asked for a nerve block to help with the pain. Once we got that, which was a month before she passed, she had no pain and didn't need as much morphine as she was taking. So again, the end-of-life care teams need to assess that morphine is not the be-all and end-all. In fact, morphine shortens life expectancy to the point where the body's so fatigued it can't fight anymore. And when she went to sleep, she never woke up. So if you're suffering the similar sort of journey we're on, please challenge the oncology teams, get them to engage with other cancer research units like Royal Marsden early in your diagnosis. Ask them to make sure that they're collaborating with other cancer research teams locally, nationally, and regionally. Our team didn't do it until it was too late. And I think that's a failing on them. People I've spoken to saying that you should take this further and put in an official complaint to the hospital, but it's not going to achieve anything. All I would say is Jayne's legacy is to help and stop and prevent this from happening to anyone else. So if you are on this journey and you have been diagnosed with cancer in the breast, please make sure that you talk to the oncology team and understand the pathway that they're giving you. And if you feel it's not the right pathway, question them, challenge them, and ask them for alternative treatments. There are alternative treatments out there. There's immunotherapy, there's hormone treatments as well. So please don't just go with what they're telling you. Question them on everything. Get them to explain to you in detail what they're doing and why they're doing it. Because we didn't ask all the right questions at the time. We made the same assumption that 99% of people do, is they know what they're doing, they understand the disease, and they've treated this successfully with lots and lots of women. So at the moment, 1 in 2 women are diagnosed with breast cancer. And from what I've seen, 1 in 2 do not survive it. So please, please challenge your oncology team and your breast cancer team. Rely heavily on your Macmillan team. And if you're not happy with the treatment, question what else is available, because there is a way to either slow it down or inhibit it. And I'm hoping that they can learn from my wife's passing and from the biopsies they took why this cancer did not respond to the 4 different types of chemo. And that was Paciltexel, Ribociclib, ductal, and I can't remember the other one. But basically, none of those chemo treatments that they had in their pathway touched her cancer. Thank you.